You really need to sit back and say, what do I want out of this product? What goals do I have? What outcomes do I want to have? When you are looking at a house-wide system, you have to look at a variety of functionalities as well as a variety of people who are going to use this product.
I'm in Centriq a good portion of every day looking at various documentation issues, billing issues. I work in probably 6 or 8 of the modules every day. The navigation is very easy, and I thought it was quick to learn, and I also I can fly around the program. It works very well for me.
One of the features of Centriq that we like is the way it's easy to teach new employees. Whether we're looking at a financial office worker or a nurse, Centriq is easy to navigate. It's simple to learn.
It was interesting to watch users as they were introduced to it, because it didn't take them long at all to figure out how to navigate and to figure out how to use the product.
The fact that there was a product that we could use in all areas, from the laboratory, radiology, nursing, clinical documentation, led us down the path to choose Centriq.
We've been very pleased here at Horn Memorial Hospital to have one product that can be used throughout the departments of the hospital. Billing, accounts receivable, laboratory, radiology, the therapies, all of the departments are working in the Centriq product.
I like how they all the applications work together. I think that's one thing that as a hospital we discovered early on, was how interdependent we are in providing health care to our customers, and that means from the bedside to getting reimbursement to be able to provide more services.
The entire concept of meaningful use is very concerning for hospitals. How are we going to do it? How are we going to get there? Healthland and Centriq will get us to meaningful use.
We're going to be meaningful use stage 1 this year, but as we all know, there's 2013 with stage 2, and 2015 is going to be the next stage. So we fully expect to be there, right with Healthland leading the way for us to meet that meaningful use requirement.
One thing that an electronic health record has done for our whole organization is, especially when you have an integrated product, you have to work together. And I would tell you that we are a much closer organization, department to department, than we were before we started, because we had to work together.
Our nurses before Centriq were strictly paper, and now that we've become electronic, I think already our nurses are saying we'll never go back to paper. Centriq has enabled us to use simple devices like iPads or netbooks instead of a full installation on a laptop or a desktop. Those devices are out the door. Now we can use a portable device to do our charting.
In Centriq, the one thing that I really enjoy is the EMR. It's really easy to read. It puts all your meds in time that they're due. So all your 8 o'clock meds, you can go in and you know that that's what's due at 8. You can administer them all at the same time after you've given them.
And it's so nice that when the nurse administers the medication, behind the scenes, all of the charges that are attached or associated with that medication fire to the billing package, and it's just a lovely way to capture charges without anyone having to do that specific task, because the program takes care of it for you.
A lot of the nursing staff really enjoy the work center. They like the ability to be able to move from patient to patient. They like the search function where they can stay on the same screen but yet move to a different patient, so it makes completing their assessments quick and easy.
As a nursing administrator, safe patient care and good patient outcomes are a primary goal, first, foremost, always. The electronic health record is a tool to get there. It facilitates the process of safe care.
Ease of use, speed. I mean, in the healthcare system, I don't care who your user is, they are interested in how quickly can I get the information, how quickly does it load, and it's the information I want. And so You have to have a system that's fast. You have to have a system that's easy to navigate. I consider Healthland a partner in this, and the people that I've worked with have functioned as partners here with us, and they've worked with my staff as if they worked here.
We here at Grape fully expect that our relationship with Healthland will go years down the road. I would easily recommend Centriq to any other hospital.
We are very vital to our community, and the patients that we take care of, we see them in the grocery store, we see them at church, we see them at our children's soccer games, and so that gives us a greater accountability to those people. We have to provide the best care that we can because they're our neighbors, they're our families, and we have to do the best we can for them.